Hello there, my name's Joanne Vaughan and I'm the Head of Assessments Independence for Dudley Council. The health and social care sector have always struggled to support people to be discharged from hospital in a timely way. So in 2017 we were awarded some monies to help us challenge the system and to be able to make a system change to improve this.
The first question is, why are delayed transfers of care important? They're important for two reasons. If we don't get people through the hospital and discharged safely and quickly, then other people who need urgent and emergency care will have to wait longer for it. And secondly, people who've got planned care or operations scheduled run the risk of having those operations delayed if we don't respond quickly. So it's really important that we respond fast, safely and accurately. The next question is, what do we need to do to improve? And that's what the Better Care Fund is all about. So government has told us that we need to reduce all delays in the hospital to a maximum of 3.5%. For Dudley, that represents a significant numbers of beds, so we have to look at every aspect of the admissions and discharge pathway to drive that change. There are 8 areas that we focused on to do that, ranging from stopping people coming in the first instance, getting people back on their feet more quickly, getting the right care in place, and using technology aids and adaptations to help people stay independent.
What we needed to do was look at different ways that we could get patients home, and different pathways were introduced approximately 2 years ago. So discharge to assess is something that is known and recognised nationally. So we worked as an economy around discharge pathways 1, 2 and 3 at the time. We had better success at pathways 1 and 2. So pathway 1 was those patients requiring a package of care. And we worked extremely hard with local authority colleagues and them commissioning the appropriate care. And we were working to approximately 24 hours turnaround for those patients. So we saw that come from between 3 to 4 days down to 24 hours as an average. So that worked really well for those patients, and also gave support back to the wards and the clinicians where they could start to recognise that there were change. The pathway 2 was around intermediate care, so we focused on early assessment of those patients and also 7-day assessments. So at one point we only had Monday to Friday, so we worked at achieving weekend discharge as much, so there was a focus on 7 days a week. So we had real success.
I'm Kath Scott and I'm a community carer on front of house at Russell's Hall Hospital. And what we do is we're a team of 4 social workers, 4 community carers and 4 ACCs. The ACCs and the social workers will go up onto the wards and they will do assessments when they've been told that there's a patient medically fit and the TTOs are ready, that's medication, and the transport is booked for them to go home. They will do a referral. They will come to us and tell us the patient's name, and we will go up onto the ward and discuss this package of care with the patients. Puts their mind at ease, makes an easy transition home. And then after that we follow them home within the hour, start the care package, do all the paperwork, we can assess the patient, assess the home, see if there's any equipment that they need, any referrals we can make either to home call, a fire service, things like that.
My name's Jo Weston. I work for LJM Home Care based in Brierley Hill. We take on packages of care from the local authority, providing a full service for people in their own homes with a personal-centred approach to care. The benefits from obviously going down to single-handed care with the new funding has been that we can now look at a range of calls that we've got in place already, which are double ups, and then maybe adapting that call down to a single-handed care, which means that the service user will get, you know, one-on-one more care, and then also it's the staff member that's looking after that person can get more of a personal approach and with a more personal-centred need, and adapting that call into the place where we can put single-handed care into place. Another benefit is that we can liaise. I've got with the OT for that area, for the manual handling team, and they then can come and assess the client within 24 hours. And then the equipment then can be put in less than a week now, where before it would take a few weeks to have the equipment, somebody to go out and assess it. Now with the single-handed care, the equipment is placed a lot quicker than it was before, and which hence we can relieve the beds in the hospital and then get the care in the community as quick as possible, which is a benefit for the service user then, because they're seem to be in their own environment, that they tend to get well a lot quicker than they would do in a hospital environment sometimes, which is good for both really, for the company and also for the service user.
It's a good service, it's a good idea because it stops bed blocking in the hospital, the patients get to know us, it reassures them about a care package. Sometimes they're in doubt about people coming into their own homes, but it just gives them that little bit more confidence, especially the asking questions before they do go home.
My name is Diane Williams. I'm the registered manager at Newbury Manor Care Home in Oldbury. Some time ago, Dudley Council asked me if I would consider taking 6 beds for Pathway 3. Pathway 3 beds are used to free up the hospital beds from Russell's Hall Hospital. I agreed, and so far we have looked after 14 clients. The clients come in with a full assessment already been made by the social services and the hospital, and they stay with us for 28 days. This allows the client to come to terms with either staying in a care home, or it gives the families time to look around for another care home which is appropriate and near to where they live to meet their needs. From the 14 beds, it really has been a success. It's been a success for us because we've never done it before, but most importantly, it's been a success for the residents who've gone on to, some have gone to care homes, some have gone home, and it's the ones who've gone into a care home, it's given them an introduction into what care is about. It's nothing to be fearful of, it's not the end of their life, it's the start of the next phase of the life. And we're happy for the residents who've gone home to be in the care of their families. So all that I can say as far as Newbury Manor is concerned, it's working very well.
So the changes were brought about by the monies that came from the Better Care Fund, and what we started to see quite quickly was obviously the Pathway 3 and the 24-hour care turnaround. So by Christmas time of last year, when predominantly we have high numbers of delays, we only had 45 patients who were medically fit for discharge that were awaiting a discharge need, and that was a massive transformation from our perspective. And at that point we were dubious as to how that was sustainable, but following Christmas period and onwards, we've maintained a level of fit for discharge patients. So trust-wide, that's been approximately 60 patients.
In August last year, we were well and truly on the naughty step. Out of 151 councils, we were 132 positioned nationally. It wasn't a place we wanted to be. But with all the improvements we've put in place with the schemes, in January of this year, we have jumped to be in at 89th, which is a tremendous result from what we've had before.
In terms of how it's gone, we've seen a huge improvement and reduction in adult social care attributable delays. So from the period August through to January, we saw a 94% reduction. Statistics in their own right don't tell the whole story, but if you think about the number of people who would have got their care more quickly, particularly at the winter period where we're under huge pressure, that represents a staggering performance. We're rising up in the National League tables, and all parties agree we've made significant improvements and the best is yet to come.
We are 3 months in to a 3-year project. We think we have achieved so much and a tremendous amount for Dudley Borough. What we want to do now is work with our partners to sustain what we've got for the future.